Guys, look at this question asked here. Drugs to treat leptospirosis. Are you able to see here? The drugs to treat leptospirosis they have asked here, guys. Only the drugs to treat leptospirosis. So first of all, what is leptospirosis? It is a disease caused by the bacteria Leptospira. So it's a spirochete bacteria. So you can see here spirochete bacteria which will be there in contaminated water, and basically how does it reach this water? Through the urine of this rat, etc. Because it will be in the kidneys of these rats and all. There it may be asymptomatic. Then these rodents will urinate and it will enter the water, and if you go swimming in it or you have any abrasions, cuts, etc., then you can get this leptospirosis. So Leptospira interrogans, this is the pathogenic type in which you have the icterohemorrhagic that type which will be in rats, and canicola in dogs. Okay, so just remember Leptospira interrogans is the pathogenic one. Okay, and this disease is very common in tropics. That is why they are asking you for the exam, because it mimics a lot like dengue, malaria, etc. So you should know about Leptospira if you are in India, right? And it will be, I told you, where will it be? In the kidney, right? In the kidney of these rodents and all, and whenever they urinate, it will be coming out. Okay. So what they are saying is, especially if you have cuts and abrasions, then only it will enter for humans. They are saying humans don't infect other humans. Incubation period 1 to 2 weeks, so nothing will happen after 1 or 2 weeks of swimming there. Okay, first it will be bacteremia. The bacteria will be in the blood, and then it will enter all this kidney favorite, liver, meninges, brain, etc. Okay, so it will cause what I told you. I'm not going into the details, but bacteremia I told you, then it will cause meningitis. Then Weil's disease is the severe form where you have icteric leptospirosis, some hepato renal hemorrhagic syndrome. So uveitis also can be there here, and then pulmonary syndrome to the lungs also it can affect. Okay. So initially blood culture will be positive, then you will have to check urine. Okay, I told you, right? First it will enter the blood and then it will be in the urine. And then urine it will be there long time, because from the kidney it will be getting excreted. So lab diagnosis, guys, standard PCR, growing in media, inoculating animals, electron microscope, serotype testing, all this. Okay. Basically what I want you to focus on here is that initially blood and then urine. Okay. So you got all that. Now let us go to the next slide here, that we have prevention. So basically you know that this bacteria loves to live in water and in the kidney, and they come out in urine and live in the water. So basically water should be clean water, you treat with chlorine, etc. Rodent control, keep those rats away. And then drugs, they are saying doxycycline can be taken for prevention. But what have they asked you in this exam? Treatment of leptospirosis, then that to the drugs that you use for treatment of leptospirosis. So the drugs here we will tell you, these are the drugs. Okay, just focus here. Doxycycline, penicillin, ceftriaxone. Okay, doxycycline, penicillin, and ceftriaxone. Doxycycline is a tetracycline. This is the only option they have given here as oral. So this is oral doxycycline, 100 mg twice daily for a week. Okay, 100 mg twice daily for a week. What are you giving? Orally doxycycline. Very good. Or they're suggesting intravenous penicillin. This is penicillin G, I'm thinking. Okay. Then, but you should always be careful. This is this people can have reaction to it. And other than that, they're also saying parenteral ceftriaxone also can help. Ceftriaxone is what? They're talking about ceftriaxone 1 gram daily. This is third generation cephalosporin. This is parenterally given ceftriaxone. Okay. So if you look at the classification, because this is what we have come here for this exam, they have asked the drugs. So learn the drugs properly. Penicillin, they're talking about penicillin. Then they're talking in penicillin itself you have this amoxicillin and all. I'm not sure if you can give amoxicillin as such, but they're saying penicillin you should give. Okay. Then the next drug they spoke about is tetracycline, that is doxycycline, 100 mg twice daily for a week. Oral, this is the only oral option that they have suggested. And third generation cephalosporin, that is ceftriaxone parenteral. Okay, ceftriaxone they are talking about. So ceftriaxone, how much they are saying you should give? 1 gram daily. Okay, they didn't say for how many days, but so what they're telling is when you give these drugs, main thing I think they want you to also focus on is the JHR reaction, because the spirochetes will die, right? When there's large number of spirochetes dying, they will release endotoxin like substances that can trigger a systemic inflammation response. So there can be a reaction called as jarish some reaction. Okay, so that is why they are saying that you should be careful when you're giving these drugs. The other things that they're suggesting for treatment is blood transfusion for hemorrhage, and because of if there's acute kidney injury, do dialysis. They are saying, guys, this is what we are trying to say is that this leptospirosis symptoms will be so similar to dengue, malaria, typhoid, etc. That is why you should be very careful, and it affects in the tropics a lot, right? So whenever there is thrombocytopenia with fever, right, that is platelet count is low, and there's fever, and there can be a rash. So you should always keep leptospirosis in your mind. So in the exam, they have asked you the drugs used for treatment: doxycycline, penicillin, ceftriaxone. What you will understand here is there is no steroid. Steroid is not there, okay? But steroid you will use where, if there is uveitis, you will use steroid, okay? So uveitis is treated with systemic antibiotics and local glucocorticoids, okay? Local corticoids only for the eye. Okay, so this is another treatment, right? Drugs used to treat leptospirosis, you will write this also. If it is there uveitis, then you will give local glucocorticoids and systemic antibiotics. Which are the systemic antibiotics? Doxycycline, penicillin, ceftriaxone. Very good. If somebody asks Weil's disease, also same thing only you have to write. Okay, don't forget. Weil's disease, leptospirosis. For the others and all, you write standard things. Okay, pulmonary syndrome, oxygen giving. Right, you got that right. If there is ARDS, acute respiratory distress syndrome, then you can do what is required. Meningitis, again, you will need the antibiotics itself, right? We already told you kidney injury means dialysis. Uveitis means you will give that systemic antibiotics with local glucocorticoids, okay? That's it. Bye-bye.